Hello, welcome back to the channel.
Today's
News
is causing a lot of debate.
So make sure you talk the real stuff
until the
happening
end
around
to
the
hear all
country.
the sources
And today's
try
story
verify
is one
everything
that
for
touches
yourself.
on both our hearts and our
if you're
health
new
system.
here,
Please don't
please
forget
stay
to
with
hit
me
that
until the
subscribe
end
button
so
you
you
never
hear
miss
where
an
the news
update.
came from and check things out for yourself if you
Gauteng Premier
want.
Lesufi
And
has
don't
stepped
forget
in
to
and
hit
made
that
it clear
subscribe button
he doesn't
so you never
support
miss
the
the
idea of
updates.
blocking undocumented foreigners
the
from
Department
accessing
of Health
public
has come
healthcare in
out and said
Gauteng.
that South Africa is
Over the
currently
last few
carrying the
months,
cost of
we've
treating
seen
foreign
some
nationals
groups
in
and
public
individuals
hospitals
taking
and
matters
clinics
into their
and
own
yes,
hands,
while they
standing
admit the
outside
system is
clinics
under
and
pressure.
hospitals,
They also say
demanding
they're sticking
IDs
to
or
the
papers
constitution
from people before they can even
It's a
see
tricky
nurse.
situation that's been frustrating
Lesufi
both
says that's
healthcare
not
workers
the
and
solution.
patients, especially
He was
those
very
who've
firm
waited
in saying
hours
that
in
while there's
overcrowded
no denying
facilities.
the healthcare system is
The
under
health
pressure,
department says
trying
they're
to
fully
solve it
aware
by
that
turning
treating
people
everyone
away
who
is
walks
short-sighted
into a
and
clinic,
dangerous.
especially those
It may
without
look like something
documentation,
is being done,
is putting a
but
strain
in
on
reality,
budgets,
it's
staff,
making things
and
worse.
stock.
He
In
said
provinces
healthcare
like
isn't just
Gauteng and
about
Limpopo,
citizens,
hospitals
it's
are
about
seeing
public
high
safety,
volumes of
and when
patients
people
daily,
don't get
and
treated,
many of them
it
are not
affects
South
everyone.
African citizens.
Lesufi stressed
But
that
according to
diseases
our
don't
laws,
care who you are or
especially
where
the
you're
National
from.
Health Act,
If
the
someone
government
sick
is
is
obliged
denied
to
treatment,
provide basic
it
healthcare
doesn't
to
just go
anyone
away.
who needs it, regardless of where they come from. It becomes more
Now,
expensive
that
to
means
treat
if
later.
a pregnant woman from
And it
Zimbabwe
puts
or
even
a
more
child from
pressure on the
Mozambique
system.
walks into a clinic in
So in
Mzansi,
his words,
they cannot be
these
turned
tactics
away.
of gatekeeping
They'll be
clinics aren't
treated the
just
same way
illegal,
any local
they're
patient would
irresponsible.
be, at least
The
for
South
primary
African
health
Human
care like
Rights
immunization,
Commission agrees.
TB, HIV
They've reminded the
services,
public
and
and
maternity
healthcare
care.
workers that the Constitution
And while many
guarantees
South
access
Africans
to healthcare
understand
for
this from a
everyone,
human rights
regardless of
perspective,
nationality
others
or
are
legal
raising tough
status.
questions about how
That
sustainable
includes
it is,
emergency
especially
care,
when citizens
maternal
themselves
care,
are sometimes
and help
turned
for
away
children
because
and
the
vulnerable
facility has
people.
run out of medication,
Lesufi
or
also
there
made
is
it
only
clear
one
that
doctor
if
available
people
for
are
hundreds
upset
of
about
people.
how many are using the system,
Deputy Minister
then
of
the focus
Health
should be
Joe
on
recently
fixing what's
spoke
broken,
about this.
better border control,
He didn't deny
stronger
that the system is
administration,
stretched,
and more investment into
in fact,
healthcare.
he acknowledged that
Not
the burden
intimidation
is getting
at
heavier,
clinic gates,
but he said the department
the
can
government
simply break the
stance
law
is that
or
all
ignore
people in
international
South Africa,
obligations.
legal or not,
According
must
to
be
him,
treated with
South
dignity,
Africa has to lead
especially
with
when
dignity,
it comes to health,
even when it's hard.
In his view,
Some people,
a lot of these actions,
especially from civic
organizations
and
political
away,
movements,
demanding to
have
see
accused the
passports,
department of
filming and
prioritizing
shouting at
foreigners
sick
over
mothers,
citizens,
are not just wrong,
but
they're
the health
distracting everyone
department has
from the
denied
real
this
problem
and said the
the
problem
healthcare
isn't just
system
foreign
is underfunded,
it's years of
mismanaged,
poor
and
infrastructure,
overwhelmed,
limited budgets,
and he didn't mince his
hiring
words.
doctors
He
and
called
nurses.
out those who are encouraging
They say
clinic
the real
blockades
enemy
and said
here
they're
is the
doing
system
more harm
itself,
than good,
not the people using
He's
it.
calling on everyone,
Still,
especially public
many
servants
clinics
and
are
political
reporting that
leaders,
more than a
to
third
stop
of their
playing
patients are
politics
foreign
with people's
nationals.
lives and start looking
That's
for
a
real
big
solutions.
chunk, and the staff on the
Now,
ground
to
are
be
the ones
honest,
feeling it
there's
the
no
most.
easy fix.
Nurses and
South
community
Africa
health
is going
workers
through
are
a
saying
tough
they're
time.
exhausted. Budgets
There's
are
not
tight,
enough equipment,
communities are stretched,
there's
and
not
tensions
enough
are
medicine.
high. But
And
there's
taking it out
definitely
on
not
sick
enough
people,
support.
people who might just need
The department
antibiotics,
says it's working on new policies
or help with their
including
baby,
ways to
is not how we
recover
fix a
some
country.
of the costs or get support
Lesufi's
from international
message
donors.
is clear. Let's work
There's
together
also
on
talk of
policy,
using the upcoming
not punish
national
each
health
other at the
insurance
gates.
system to manage the
All the
situation
images
more fairly.
used in this video are for
But that's
illustration
still a
only.
long-term plan.
They
And
help
people
paint
on the
the
ground
picture,
need
but
solutions
the facts
now,
are based
not
on
10 years
verified
from
reports,
now.
official statements from
for
the
now,
Premier,
the
and
Department
comments
of
from
Health
rights
is
groups.
standing firm. You can
They're
double-check
saying,
the news
yes,
through official
we are
government
overwhelmed,
and media platforms.
but we can't abandon people in
And
need,
now,
no
just
matter
before
where
we
they're
wrap
from.
up, let me drop
They've
a little
also
joke,
asked South
because
Africans
even
to
in
understand
serious
that
times,
healthcare is a
we
human
all need
right.
a laugh.
Why
Why
did
did
the
the
national
thermometer
one
bring a lawyer
and
to
the
the
Constitution doesn't allow for
because it was
discrimination
getting
in this
too much
space.
pressure and needed
All
representation.
the images you see in this video
Anyway,
were used just
thanks
for
for staying with
illustration
me
and
till
don't
the end.
represent anyone involved
If you
in
found
this
this
specific
eye-opening,
case. Go ahead
the
and
news
like the
sources
video,
used for
share
this
it
report
with your
include
friends,
statements
and
from
don't
the
forget to
Department of
subscribe
Health,
so you're always in the
interviews
loop
with
with
Deputy
what's really
Minister
going
Fowler,
on in
and
Mzansi.
reports from local South
Until
African
next time,
journalists who've
stay
been
safe,
following the
stay healthcare crisis closely, and always stay informed. Thanks so much for listening. If you found this informative, give it a like, leave a comment, and hit subscribe so you stay in the loop. And before I go, here's a little joke for you. Why did the patient bring a ladder to the clinic? Because the queues were so long, they figured they'd have a better chance climbing the system than waiting in it. Stay safe, stay kind, and I'll catch you in the next one.